Welcome back and thanks for keeping me company. Well, as health workers around the world put their lives on the line in the fight against the coronavirus pandemic, many have died and thousands have tested positive for the deadly disease. A global shortage of personal protective equipment has added to the problem and added to the huge toll of physical and mental well-being. In Kenya, the frontline soldiers are on strike, demanding better pay and better working conditions. Our health reporter, Purity Museu, explores the journey since the pandemic hit the country way back in the month of March. Take a look.
The phenomenon of people cheering in the evenings to show their gratitude to frontline health workers amid the Covid-19 pandemic began in mid-January 2020 in the city of Wuhan in China, where the virus originated. People under lockdown were showing their appreciation to the medical heroes by applauding them. The trend quickly spread worldwide as more nations began being affected. In Kenya, the clapping tradition began on Wednesday, April 22nd, 2020, a month after the Ministry of Health confirmed the first COVID-19 case. It came a week after President Uhuru Kenyatta directed establishment of a welfare package to reward health workers working round the clock to contain the spread of the novel coronavirus.
The critical importance of health, mental and emotional needs of our frontline medical doctors, nurses, and other medical professionals. I am today directing the Ministry of Public Service and the Ministry of Health to develop a welfare package to cushion these frontline officers, especially during this challenging time. This should include actions by medical insurance companies to cover the health requirements of our hospital staff, especially those dealing with this pandemic.
Essential service providers were acknowledged for their selfless acts that embody the true Kenyan spirit in what became a weekly Wednesday tradition. 10 months into the pandemic, close to 100,000 Kenyans have been infected with COVID-19, while more than 1,734 have died from the disease. Among those infected are over 3,000 healthcare workers. More than 30 medics have died from the disease. Also, the Wednesday clapping sessions are no more. And health workers have resorted to industrial action after months of decrying unfavorable working conditions, including lack of enough quality personal protective equipment. For 6 weeks, nurses have remained off duty after donning tolls on December 7, 2020. Doctors, clinical and laboratory officers are also on strike with similar demands.
There will be no going back without commitment of the due level of government to compensate families who have lost nurses due to COVID-19 and other elements. We will not go back to work if there's no commitment to refund money that has been spent by nurses during their treatment when they were sick.
Na pia tutaanza maandamano yale ambayo ni maandamano kwa ajili ya kupinga maamuzi ya Council of Governors.
The Council of Governors has declined to sign a return to work agreement that could resolve the stalemate.
Hata waende strike miaka 100. Hakuna pesa mimi nitalipa. Kwa sababu our nurses wanalipa hata kuliko engineer.
In the meantime, services in most public hospitals remain paralyzed, with patients left to suffer as the second wave of COVID-19 continues. Purity Museu, Channel 1 News, Nairobi.